You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello, thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about what to expect in a cesarean birth. A cesarean birth is among the most common surgeries in the United States, with about 1 in 3 babies delivered this way. Whether you are planning a cesarean or aiming for a vaginal birth, understanding this procedure will help you feel more confident to handle any situation. This episode will explain why cesarean births happen and guide you through the process step by step. I'll cover anesthesia options and describe what recovery looks like both in the hospital and at home. This episode will also help you prepare for the emotional aspects of a cesarean birth, learn how to make informed decisions if an unexpected situation arises during labor, plus find out what a cesarean means for future pregnancies. Knowing what to expect from a cesarean birth is one of the most important ways you can prepare for labor, regardless of the type of birth you are planning. You can see the full article and all of the resources for this episode at pregnancypodcast.com/cesarean. You are on the public feed of the podcast, which gives you ad-supported content for the last year. Become a Pregnancy Podcast Premium member. Not only will you never hear advertisements, you also get access to hundreds of episodes with evidence-based information that you won't find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. 8 Sheep Organics makes amazing 100% clean natural pregnancy products. From skincare to treating common symptoms like stretch marks with clinically proven ingredients, 8 Sheep Organics has you covered. And every product comes with a 100-day happiness guarantee. Try it risk-free. If you are not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. AG1 is the daily health drink that combines your multivitamin, pre- and probiotics, superfoods, and antioxidants into one simple green scoop. It's one of the easiest things you can do to support your body every day. Head to drinkag1.com/pregnancypodcast. And when you first subscribe to AG1, you get an AG1 welcome kit, a bottle of vitamin D3K2, and you'll get to try each new flavor of AG1. Go to drinkag1.com/pregnancypodcast. I'm a huge advocate on educating yourself about cesarean. You can plan all you want for a vaginal birth, but the moment that your doctor says that you need a cesarean, if you have not prepared for that possibility, you are completely out of your element. You don't know what happens next. You don't know what your options are. And then you have to make decisions about a major surgery in real time. That can be a frightening situation. And it's one of the main reasons that this topic is so important for every expecting parent, not just those that are planning on a C-section. Let's start with exactly what a cesarean is. A cesarean section is also known as a C-section. This is a surgical procedure that delivers a baby through incisions into the abdomen and the uterus. Your doctor can plan a cesarean ahead of time if a complication comes up that will make vaginal delivery difficult. In other cases, there are unexpected circumstances that arise during labor that lead to a cesarean. Sometimes a cesarean becomes necessary very quickly, and your care team may not have the time to explain every detail in that moment. That is exactly why this education matters. If you already know what a cesarean involves, you're going to feel so much more prepared and in control, even in a fast-paced situation. So the goal of this episode is to give you that foundation whether a cesarean is part of your birth plan or it's just something that you want to be prepared for just in case. I mentioned that about 1 in 3 babies are born via cesarean. The overall rate in the United States is 32.3%. If you look at only low-risk pregnancies, because of course some people that are high risk will need a cesarean and they know that well in advance, the rate for low-risk pregnancies is 26.6%. A low-risk pregnancy means that you have a single baby, not twins or multiples, that they are at least 37 weeks, they're in a head-down position, and it's the mother's first baby. Even among low-risk mothers, more than 1 in 4 will have a cesarean birth. And the truth is that many of these moms went into labor planning for a vaginal birth. A cesarean can be a life-saving procedure for a mom or a baby, and we have to acknowledge that. However, like any major surgery, it does carry risks. To minimize those risks, there is an incentive to lower the cesarean rate. The World Health Organization states that cesarean rates above 10% are not associated with further reductions in maternal or newborn mortality. Some research suggests that the optimal rate may be closer to 19%. Either way, the US is well above that. Globally, 21.1% of births are via cesarean, with projections reaching 28.5% by 2030. A cesarean is a major abdominal surgery, and access to safe surgical care will vary a lot in different places in the world. So that's why the global number is much less than the number in the United States. Let's cover why cesarean births happen. There's a lot of reasons why a cesarean could be planned ahead of time or that it could become necessary during labor. There's some moms that know well in advance that they need a C-section, and others will have circumstances arise in labor that change their plans, so let's walk through both scenarios. First, planned cesarean births. There are certain maternal health conditions like heart disease, gestational diabetes, high blood pressure, kidney disease that can make a cesarean a safer option. A vaginal birth could also pose risks for a baby that has certain congenital conditions like neural tube defects. If there's a risk of passing an infection to your baby during a vaginal birth, that would be the case with something like the herpes simplex virus or HIV. A cesarean can prevent transmission. Also, complications like preeclampsia or eclampsia can also require a C-section. Another reason could be a mechanical obstruction, like a large fibroid that's blocking the birth canal, or severe hydrocephalus, which means that your baby has an unusually large head, and that can make a vaginal delivery unsafe. If your baby is unusually large, this is a condition called macrosomia, your care provider could also recommend a C-section. One very common reason for a cesarean is a breech baby. Ideally, your baby is in a head-down position. This is called vertex. The most widely cited statistic is about 3 to 4% of babies are not head down at term. So that means that they're butt first or feet first. Because very few doctors have training in vaginal breech birth, most mothers that have a breech baby will require a cesarean delivery. If you are getting closer to your due date and your baby is still not head down, there are a couple dedicated episodes about your baby's position and the evidence on methods to turn a breech baby, and I will link to those episodes in the article for this one. One other reason that a cesarean could be scheduled ahead of time is if you have placental abnormalities. Placenta previa, that's where the placenta covers the cervix, would make a vaginal birth unsafe. A cesarean could be recommended after a previous invasive uterine surgery like a myomectomy. It could also be planned if you had a previous cesarean and you're not pursuing a VBAC, which is a vaginal birth after cesarean. And we'll talk more about that later in this episode. Another available option is an elective cesarean birth. The American College of Obstetricians and Gynecologists supports a cesarean delivery on maternal request, meaning it's a cesarean because you're asking for it, but they do have some important nuance. If your main motivation is a fear of pain in childbirth, ACOG recommends that your care provider discuss and offer pain relief options for labor, along with prenatal childbirth education and emotional support. In the absence of a maternal or fetal indication, meaning that there's not a specific reason why you require a cesarean, ACOG states that a plan for vaginal delivery is safe and appropriate. They go on to say, if after exploring your reasons and discussing the risks and benefits that you decide to pursue a cesarean on maternal request, they recommend that it should not happen before 39 weeks. ACOG also emphasizes that because the repeat cesarean delivery rate is high, that you should understand the risks of placenta previa, placenta accreta, and hysterectomy increase with each subsequent cesarean. If you know from early on in your pregnancy that you want to plan a cesarean delivery, the most important step is to make sure that your care provider supports that decision. Not all doctors will be supportive of cesarean delivery on maternal request, essentially an elective cesarean. So this is a conversation to have early. If your provider does not support that option, then you may need to find one who does. Elective cesarean delivery is much more common in other parts of the world. Countries like the Dominican Republic, Brazil, Cyprus, Egypt, and Turkey have cesarean rates that exceed 50%, so more than half of babies in those countries are born via C-section. In Latin America and the Caribbean, the average cesarean rate is almost 43%. In some of these countries, scheduling a cesarean is culturally accepted and it's a widely available option. Research has found that there's a mix of factors that drives those higher rates. Things like fear of labor pain, concerns about pelvic floor damage, and a belief that cesarean delivery is safer than a vaginal birth. In the United States, cesarean delivery on maternal request is less common, but it is a valid choice, and ACOG supports it under the guidelines that we talked about. Now that we have covered all of the reasons a cesarean would be planned, let's talk about unplanned and emergency cesarean births. Many mothers who have a C-section didn't go into labor planning on it. The two most common reasons for an unplanned C-section are that labor is not progressing or that your baby's heart rate is concerning. One study of over 38,000 women found that 35.4% of cesareans resulted from a labor that stalled. Your care provider is tracking your labor progress through vaginal exams, where they're checking to see how your cervix is dilating and effacing, and through electronic fetal monitoring, where they can monitor your contractions. In that same study, they found 27.3% of cesareans were due to non-reassuring fetal heart rate. Electronic fetal monitoring also allows your doctor to monitor your baby's heart rate. So together, that non-reassuring fetal heart rate and a labor that is not progressing are the two reasons that account for the majority of unplanned cesareans. In both of these situations, your care team would typically try less invasive methods before they're recommending a cesarean. However, there are some emergencies that will leave very little time for alternatives. Some examples of that could be a prolapsed umbilical cord. That's when the cord slips through the cervix ahead of the baby. If the uterus is compressing the cord during contractions, it could potentially cut off the baby's oxygen supply. Another emergency reason could be a placental abruption, and that's where the placenta separates from the uterine wall. And these emergency scenarios are far less common than something like labor not progressing or a non-reassuring fetal heart rate. While all of the physical aspects of a cesarean get a lot of attention, We also have to cover the emotional impact, especially in the case of an unplanned C-section. It can be very challenging to emotionally shift when your birth plan changes from expecting a vaginal birth to being wheeled into an operating room. A study that followed more than 1,100 women who gave birth found that over 1 in 4 women who had an unscheduled cesarean experienced clinically significant acute stress shortly after birth. By comparison, this was about 1 in 16 women who delivered vaginally that had that same level of stress. Even after accounting for medical complications, prior trauma, mental health history, unscheduled cesareans were associated with more than double the risk of severe stress. These acute stress responses predicted subsequent PTSD symptoms, depressive symptoms, and difficulties with maternal-infant bonding. More research on birth experiences shows that the mode of delivery affects how mothers feel about their birth. One study found that women who had an unplanned cesarean were more likely to report feeling disappointed or sad compared to women who had a spontaneous vaginal delivery. About 21.5% of women who had an unplanned C-section reported feeling traumatized by the experience. That may sound scary. It is important to put this into context. Women reported feeling traumatized across all delivery modes, including 23.1% of women who had an instrumental vaginal delivery and 12.8% of those who had a spontaneous vaginal birth. So this wasn't something that was only experienced by women who were having an unplanned C-section. I'm not going through any of this data to try and scare you. I want to encourage you to prepare. Birth can be an intense experience, and a wide range of emotional responses is normal, and that's regardless of how your baby arrives. What the research consistently shows is that unplanned procedures, limited information, and feeling out of control are the strongest predictors of a negative experience, not necessarily just the delivery mode. A qualitative study found that mothers who were not mentally or physically prepared for a cesarean described the experience as a sudden event that they could not react to. The researchers concluded that insufficient preparation increases vulnerability to traumatic birth experiences. Educating yourself about cesarean birth, including what the procedure involves, we'll talk all about that, what your options are, that can make a significant difference in how you process the experience. If you plan a vaginal birth and you know what a cesarean looks like, that can reduce the shock factor if your plan changes. And it will empower you to make informed decisions if the situation changes because you already know what your options are. A helpful framework for navigating any in-the-moment decision is the BRAIN acronym. BRAIN stands for benefits, risks, alternatives, intuition, and nothing. These are the keys to 5 different questions you can ask. Benefits, you can ask what the benefits of a cesarean are in this situation. Risks, you can ask what the risks are if you go forward with it. Alternatives, you can always ask if there are any alternatives that you can try first. Intuition, this is a reminder to ask yourself, what does your gut tell you? What does your intuition say about this? And then nothing is what happens if we wait or do nothing right now. In a true emergency, there may not be time to run through every question. If your baby's oxygen supply is compromised, your care team has to act fast. But not every cesarean recommendation is an urgent emergency. In many cases, there is a window of time that you can ask questions and talk to your doctor to understand your options. This BRAIN acronym is fantastic for evaluating a lot of interventions. Share this with your partner or whoever will be there to support you during labor. They can help advocate for you and help ask these questions if you're having trouble doing so yourself. The best way to set yourself up for confident decision-making is to build trust with your care provider throughout your pregnancy. If going into labor, you and your doctor or you and your midwife are aligned on the birth that you want, you will be much better equipped to navigate a change in those plans together. Now that we have covered why cesarean births happen, we've talked about the emotional component that can come with that. Let's look at what the research says about benefits and risks. Understanding both sides of this will help you weigh your options and have informed conversations with your care provider. Again, a cesarean can be life-saving for both a mother and a baby when it is medically necessary. For planned cesareans, the ability to schedule that delivery can reduce anxiety. It can allow you to prepare. It's much easier to get ready for a baby if you know exactly when they're coming. In certain high-risk situations, a cesarean can avoid complications of a prolonged or difficult vaginal delivery. There's some research that suggests that a cesarean delivery may reduce the risk of certain pelvic floor disorders like urinary incontinence and pelvic organ prolapse compared with a vaginal birth. However, that evidence is a little bit mixed, and this potential benefit has to be weighed against the surgical risks and the longer recovery that comes with a cesarean. The point being, there are some benefits to a cesarean birth. Like any major surgery, cesarean also carries risks. The most common complications include endometritis, that is inflammation and infection of the uterine lining, excessive bleeding, blood clots, and infection of the incision. Although it is very rare, injury to nearby organs during surgery is possible that would require additional surgery to repair, but that very rarely happens. There's also an increased risk of complications in future pregnancies, including uterine rupture. Maternal death from cesarean delivery occurs at a rate of about 2.2 per 100,000. So this is rare, but it is higher than the rate for vaginal birth, which is approximately 0.2% per 100,000 births. When we're talking about risks, there are also risks to your baby. One of the most well-known is respiratory issues. During a vaginal birth, the compression of the birth canal naturally pushes fluid out of your baby's lungs. But in a cesarean, they don't get that. As a result, cesarean-born babies are more likely to need assistance in clearing fluid and may experience temporary breathing problems after birth. Beyond that immediate period after birth, a comprehensive systematic review of 113 studies found that babies born via cesarean had a moderately increased risk of developing asthma, allergic rhinitis, atopic dermatitis, and food allergies compared to babies born vaginally. These increased risks are thought to be related to differences in how a baby's microbiome develops depending on the mode of birth. If a baby is born vaginally, they're exposed to bacteria in the birth canal that can help jumpstart their microbiome. Babies that are born via cesarean pick up different bacteria from the skin and the hospital environment. Minor injuries during the procedure could be small skin nicks. Those can occur, but they're very uncommon. It's also important to note that vaginal birth carries its own risks to babies, including injuries from instrumental delivery. Every delivery method involves trade-offs, and your care provider can help you navigate and weigh those risks and benefits based on your specific situation. The point of reviewing these risks is not to drive fear. It's to give you the information that you need to make informed decisions. Being pregnant inherently carries risk, and the most empowering thing you can do is understand those. Once the decision is made to proceed with a cesarean, the first step is anesthesia. Most cesarean births use regional anesthesia. This numbs the lower part of your body while you remain awake. There's 3 types that are commonly used: a spinal block, an epidural, or a combination of those called a spinal epidural. For a planned cesarean, a spinal block is the most common choice. This is a one-time injection directly into your spinal fluid. It takes effect quickly within about 5 minutes and then provides complete numbness for roughly 1 to 2 hours. That's typically plenty of time for the entire procedure. Another option is an epidural. That involves inserting a tiny catheter into the epidural space in your lower spine. This takes a little bit longer to take effect, about 15 minutes, but your care team can deliver additional medication through that catheter if needed. If you were already laboring with an epidural and then a decision is made to proceed with a cesarean, the anesthesiologist can increase the medication through your existing epidural. They could also utilize a combined spinal epidural that gives you the rapid onset of a spinal block with the flexibility of an epidural for continued medication. With all of these options, you remain awake, you feel no pain. You may notice pressure or a tugging sensation, but it would not be painful. In very rare emergencies, general anesthesia could be used. Under general anesthesia, you are completely unconscious, so you don't see, feel, or hear anything during the birth. This is not routine and is reserved for rare emergencies. Once the anesthesia is in place, your care team begins preparing you for surgery. The first thing they do is they insert a catheter into your bladder that will collect urine during the procedure. You will receive an IV in your hand or your arm. This is to deliver fluids and antibiotics. Antibiotics play a very important role in preventing infection. A Cochrane review of 95 studies involving over 15,000 women found that routine antibiotics at cesarean section reduced the risk of infection by 60 to 70%. In these studies, none of them closely examined how antibiotics affect the baby. If antibiotics are given to you before the umbilical cord is clamped, then they cross the placenta and do get to your baby. If you are concerned about the potential effects of antibiotics on your baby's gut microbiome, you should know one of the best things that you can do to help build a healthy gut for your baby is to breastfeed. Breast milk contains beneficial bacteria and prebiotics that support healthy gut colonization and could potentially counteract some of the downsides of antibiotics. Next, we will continue going through exactly what happens during the procedure. We'll talk about meeting your baby, recovery, future pregnancies after a cesarean, and how this all works into your birth plan. Before we do that, I would like to thank the sponsors that have supported this episode. A lot of sponsors have exclusive discounts for pregnancy podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. AG1 is the daily health drink that combines your multivitamin, pre- and probiotics, superfoods, and antioxidants into one simple green scoop. It's one of the easiest things you can do to support your body every day. AG1 goes to great lengths to continually invest in rigorous peer-reviewed clinical trials. And you know how much I love research. AG1 goes above and beyond. They test for hundreds of contaminants and impurities to guarantee that they deliver the highest quality ingredients available. I've been starting every single morning with AG1 for many years now. I love the peace of mind. I know that I'm covering all of the key nutrients that my body needs. Plus, I'm supporting my microbiome, metabolism, and my immune system. Head to drinkag1.com/pregnancypodcast. And when you first subscribe to AG1, you'll get an AG1 welcome kit, a bottle of vitamin D3K2, and you'll get to try each new flavor of AG1. Go to drinkag1.com/pregnancypodcast. As a friendly reminder, pregnant or nursing women should seek professional medical advice before taking this or any other dietary supplement. Let's get back to today's episode. Knowing what the operating room looks like and what happens during the procedure can help take some of the intimidation out of the experience. If you have a scary picture in your mind of what to expect, the reality is much less jarring. Here is a general overview of what happens. The first thing you need to know is that this entire procedure typically takes about 45 minutes to an hour. Your baby is usually born in the first 5 to 15 minutes, and then that remaining time is used to close the incision. An obstetrician is the doctor that will perform this surgery, and of course, it is done in an operating room. Operating rooms are designed to be sterile environments, and that's for a good reason. You want the space where your surgery happens to be as clean as possible. As a result, operating rooms tend to be cold, brightly lit. You may smell cleaning products. These things can feel very clinical and impersonal, but they exist to keep you and your baby safe. The next thing you need to know is that you can expect around 6 to 12 doctors, nurses, and medical staff to be present for the procedure. That number feels like a lot, but each person has a very specific role. The operating room may seem crowded, but this means that your care is very thorough. For the procedure, you lie on your back on an operating table with your arms at your sides. Nurses will cover you in sterile sheets. They're going to place a wedge under one hip, or they will tilt the table slightly. This positioning relieves pressure on your vena cava. This is the main vein to the lower part of your body and will help maintain good circulation for your baby. Then a sterile cloth, it will be hung. This is usually about the level of your chest. That will block your view of the surgery. And everything on the other side of this screen is considered a sterile field. Most of the doctors and nurses will be on the sterile side. Then the anesthesiologist will be next to your head. This is often the person who will walk you through what's happening and check in on how you're feeling. Your partner or a support person can be brought in shortly before your baby's born, and they will sit beside you. Having someone who's familiar right by your side can make a very big difference in the energy of the room. The procedure starts with your doctor cleaning your abdomen, and then they make an incision through the abdominal wall. The most common incision here is horizontal near the pubic hairline. This is sometimes called a bikini incision. In emergencies where your baby needs to be delivered very quickly, they could use a vertical incision instead, and that runs from just below the navel to just above the pubic bone. After the abdominal incision, then they make a separate incision into the uterus. The uterine incision doesn't have to match the abdominal incision. The most commonly used uterine incision is a low transverse incision. This runs horizontally. This type carries fewer risks than a vertical incision and may allow you to attempt a VBAC in a future pregnancy. A classical incision, which runs vertically on the uterus, carries a higher risk of uterine rupture in subsequent pregnancies, and as a result, this is reserved for complicated situations like placenta previa, extreme emergencies, or for certain fetal abnormalities. Once your doctor makes those incisions, your baby is ready to arrive. You may feel tugging or pressure as your doctor guides your baby out. Once their head emerges, the doctor will clear your baby's mouth and nose of fluid, because remember, your baby did not travel through the vaginal canal, which naturally squeezes fluid from their lungs. So they may need a little extra help clearing those fluids. Once your baby's entire body is delivered, your doctor should hold them up so you can see them. If you want to see the moment that your baby's born, you can request that the screen be lowered slightly. They're not going to entirely remove it because they don't want you seeing the actual surgery, but they can lower it to give you a better view. This is one of many options that you can discuss with your doctor in advance. It is absolutely possible to delay clamping of the umbilical cord in a cesarean birth. The American College of Obstetricians and Gynecologists recommends a delay of at least 30 to 60 seconds. Benefits of this are increased blood volume, improved iron stores, and reduced risk of iron deficiency anemia. If delayed cord clamping is important to you, discuss this with your doctor in advance. You can also ask about extending that delay beyond 60 seconds. But this is a conversation you have to have with your doctor. Find out what's possible given your specific situation and which options they support. I do have, of course, a full episode on delayed cord clamping. One very important thing to note is that if you are considering cord blood banking, it may be challenging to both delay cord clamping and to bank cord blood. Skin-to-skin contact is critical for all newborns, including those born via cesarean. After a very quick evaluation from a nurse, your baby should be placed on your chest as soon as possible. If the umbilical cord has not been cut yet, your baby may be placed slightly lower on your abdomen while it's still connected to the placenta, but very shortly you should be able to bring them up to your chest. Skin to skin stabilizes your baby's heart rate, breathing, and temperature. It reduces stress for both you and your baby, and it increases the likelihood and the duration of breastfeeding. Skin to skin should be routine. Let your doctor know if immediate skin to skin is a priority so that your team can plan for it. If there was some circumstance where you were not able to hold your baby right away, your partner could provide that skin to skin contact instead. And if your baby ends up going to the NICU or it takes longer, skin to skin contact has a lot of benefits, not just immediately following birth, but in those early weeks. One thing that you may notice while holding your baby is a white, greasy substance on their skin. This is called vernix caseosa. Vernix protects your baby's skin in the womb, and babies that are born via cesarean tend to have more of it because it's not getting wiped off when they're getting squeezed through the vaginal canal. Vernix serves a lot of functions after birth. It can hydrate your baby's skin, help regulate their body temperature. It can provide antimicrobial protection. You have the option to leave it on rather than wiping it off. Most of it will absorb naturally within about 24 hours. This is a topic there's an episode on if you want to dig much deeper on vernix and your baby's first bath. The main thing that I want you to know is that you should not panic if your baby comes out covered in a white waxy coating. This is completely normal and it's actually good for them. After your baby's born, your doctor needs to close the incision, and they do this using either 1 or 2 layers of stitches. This has been a very long-running debate in the medical community. Single-layer closure became popular in the 90s because it was faster and had fewer short-term complications. However, concerns emerged that single-layer closure could result in a thinner uterine scar, which could increase the risk of complications in future pregnancies. Midwifery advocates, including Ina May Gaskin, has argued very strongly that the shift to single-layer closure prioritized speed and convenience over long-term safety for mothers that were planning future births. The research on this is mixed. Some studies have found that single-layer closure carries a higher risk of uterine rupture during a subsequent trial of labor. A large randomized controlled trial of over 2,000 women that was published just in 2024 found no differences in live birth rates, uterine ruptures, or reproductive outcomes between single and double layer closure at a follow-up 3 years later. If you plan to have more children, this is a conversation that you could have with your doctor before a cesarean. You can ask them what their routine practice is, what type of sutures they use, and how their approach could affect your options for a VBAC in the future. Right after surgery, You may feel nauseous. You may experience some trembling. That's because of the anesthesia. Your uterus is contracting. You have a letdown of adrenaline. These sensations should pass pretty quickly. And as your anesthesia wears off, your care team will manage your pain through an IV medication, oral medication, or a combination of both, depending on what your needs are and your doctor's approach. Your doctor will encourage you to get up and walk around pretty soon after birth. I know what you're thinking. Getting up and moving may sound very uncomfortable after a major surgery, and it may not feel great. However, early movement is one of the most important things that you can do for your recovery. During and after surgery, your body is more prone to blood clot formation because you're lying still for an extended period. Walking helps keep blood flowing through your legs and reduces this risk. Another reason is constipation. This is common after surgery because anesthesia and pain medications can slow your digestive system. Movement can help stimulate your bowels. The mechanism here is that physical movement activates the enteric nervous system, that's the nervous system in your gut, and that promotes the movement of food through your digestive tract. Anesthesia, opioid pain medications temporarily slow this movement, so walking can help counteract that. A hospital stay after a cesarean birth is typically 2 to 3 days, and that's longer than it is for a vaginal birth. During this time, you'll have doctors and nurses monitoring both you and your baby for complications and to make sure everyone is recovering well. They will check your incision for signs of infection. They will track your movement, fluid intake, bladder, and bowel functioning. They will make sure that you and your baby are doing well in recovery. While it may sound nice to go home, take advantage of this time in the hospital. You're surrounded by doctors, nurses, specialists, lactation consultants. These are all people that are experts in their field, and they do this every day. If you're a first-time mom, those first few days with a newborn can feel very overwhelming. Take the opportunity to ask every question that comes to mind, no matter how small it seems. These experts are a resource that you will not have access to once you go home. There will be a time when you are ready to go home. And at that point, your care team will review care instructions. They'll also cover warning signs to keep an eye out for once you're at home. That's a conversation that your partner or another support person should be present for. This way, you have someone else who's informed about your doctor's instructions and recommendations. The biggest warning signs to watch out for that would be red flags to call your doctor are things like fever, severe abdominal pain, redness or swelling at the incision site, foul-smelling vaginal discharge, pain with urination, or breast pain with redness or fever. The good news is, for the majority of mothers, there are not complications, and recovery goes well once you're home. Being at home can be a big transition. You're recovering from surgery, and you're caring for a brand new human. Give yourself some grace during this time. Once you're at home, you should focus on resting and allowing your body to heal. Recovery for a cesarean takes longer than for a vaginal birth. Most doctors recommend avoiding lifting anything heavier than your baby for several weeks. You wouldn't want to lift from a squatting position. You may be surprised to learn that some doctors will advise against driving for a couple of weeks. The thinking behind this is that a sudden stop could be painful if you're driving a car and you have to slam on the brakes. And if you're taking any prescription pain medications, those could potentially impair driving. There's no universal guideline for this, and recommendations from providers may vary. We have to touch on planning for recovery. Most mothers don't think about postpartum recovery until they're in the middle of it. There is so much that you can do before your baby arrives to set yourself up for a smoother postpartum period. Of course, you know that I have episodes on this topic, but let's cover a few things specific to cesarean recovery. One is set up a changing station or a feeding area where you do not have to bend or strain. You want to keep everything that you need for your baby and for yourself within arm's reach. If you spend time in more than one part of your house, like you're spending most of your time maybe in your bedroom and in your living room, it will help to keep supplies in multiple places. You may also want to use a pillow to support your abdomen if you cough, laugh, or sneeze. And of course, wear loose, comfortable clothing that does not put pressure on that incision. Recovery from a cesarean birth is gradual. Most mothers will feel significantly better by about 2 weeks and will return to normal activities by about 6 to 8 weeks. Listen to your body and don't rush this process. If anything feels off, always contact your care provider. And this period is a great time to lean on your partner or other people that you have to support you. Your main priority should be to rest and take care of your baby. Please lean on your support system to handle everything else. I've mentioned VBAC very quickly in a couple points in this episode. For decades, the standard approach in the United States was once a cesarean, always a cesarean. So if you had a cesarean, it was never an option to do a vaginal birth. That has changed, and that's because research has demonstrated that vaginal birth after cesarean, called VBAC, is a safe option for many mothers. VBAC rates climbed in the mid-80s through the 90s, but then they started declining, and that was due to concerns about uterine rupture. But the evidence supports VBAC as a viable choice for many women. Success rates for VBAC range from 60 to 80%, and the risk of uterine rupture is low. It's approximately 0.3 to 0.7% for women that had one prior low transverse cesarean incision. While VBAC is available for many women, not everyone is a candidate. A classical uterine incision, that's a vertical incision, carries a higher risk of rupture. VBAC is generally not recommended in that case. Other factors that could influence your eligibility include the type of incision, how your incision was closed, your overall health, and the reason for your first cesarean. VBAC is an important topic that certainly deserves much more than a brief overview. This is a topic that will be covered in much more depth in the future. In the meantime, a really great resource to start with if you're looking for more information on VBAC is the VBAC Facts website. And I will put a link to that. They provide great evidence-based information to help you navigate your options. Speaking of options, there's a lot of things that were not covered in today's episode. You should know that you have a lot more options than the conventional surgical experience, which is essentially what we have walked through today. A gentle cesarean, also called a family-centered cesarean, involves modifications that give you a lot more control and can make the experience feel more personal. I am covering this topic in depth in the next episode. This will cover things like using a clear drape, immediate skin-to-skin in the OR, a slower delivery to mimic a vaginal birth, and things like vaginal seating. So if you want to know what is possible in a cesarean, which is much more than we covered today, the next episode will walk you through everything. Whether a cesarean is plan A or if it's your backup plan, preparation can make a real difference. If you're planning a vaginal birth, create a backup birth plan that covers your preferences for a cesarean. Remember, 1 in 3 babies is born via C-section, and having a plan will help you maintain confidence and autonomy if your birth takes an unexpected turn. If you know that you're having a cesarean, that makes things much easier. You can build your entire birth plan around that. The Pregnancy Podcast has a lot of resources to help you create your birth plan and make that process super simple. I will link to all of those resources. The number one thing to know about your birth plan is that it is essential to discuss your preferences with your doctor or midwife ahead of time and ensure that you're on the same page. The number one reason that birth plans fail or that your requests are not met is that expecting parents do not involve their care provider in the process. Your doctor, your midwife is your partner for this entire journey. If you have questions or concerns about cesarean birth, bring them up at your prenatal appointments. Don't wait until you're in labor. You can ask what their cesarean rate is for either your provider. You can also ask what that rate is at the hospital where you're planning to have your baby. You can ask your doctor what circumstances would lead them to recommend a cesarean and how they would handle situations like a labor that's not progressing and what alternatives they may try before recommending surgery. The more you communicate with your doctor or midwife during pregnancy, the more confident you will be if that conversation comes up during labor. You and your doctor have the same goal. You want a safe and healthy delivery for both you and your baby. And the best birth experience will happen when you guys are working as a team. I know this episode was on the longer side, and that's because this is a big, in-depth topic. To recap everything that we talked about in today's episode, I explained what a cesarean birth is and how common it is in the United States and around the world. We went through reasons why cesareans happen, both planned and unplanned. I spent time talking about some research on the emotional impact of cesarean birth, especially when it is unexpected. I talked about the framework for making informed decisions during labor using the BRAIN acronym. We went through the risks and benefits of C-sections, and then went through what the procedure looks like from start to finish, from anesthesia through the entire process, step by step to meeting your baby. I also covered things like delayed cord clamping, skin-to-skin contact. We talked about recovery in the hospital and at home, and what cesarean may mean for a future pregnancy and your options for a VBAC. I would like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share this episode if you have a friend that's pregnant. So many listeners discover the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/cesarean. If you're looking for more evidence-based information, or you just want an ad-free experience, check out Pregnancy Podcast Premium. Premium members never hear advertisements, and they get access to hundreds of episodes with evidence-based information that's not available anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.